Question 26. Which of the following is most likely to be seen on labs? And we have ourselves a heme question. 24-year-old man with sickle cell disease presents with worsening fatigue. He reports no neurologic deficits. He takes hydroxyurea and occasionally folic acid. Okay, so this is probably one of the few pharmacology questions we'll see in this practice test, but we've got hydroxyurea. Important to know about that is that we administer folic acid prophylactically to prevent macrocytic anemia. But this guy is only taking his folic acid occasionally, so that's the big hint there. You should be thinking, well, is this sickle cell, or should I be thinking about the occasional folic acid? It's probably folic acid. Why probably? Because we have homocysteine and methylmalonic acid, and only those two are going to come up when you're talking about folate or B12. So let's assume then he is folate deficient and has a macrocytosis happening. So folic acid is involved in DNA synthesis and normal replication of our red blood cells, white blood cells, and hydroxyurea inhibits DNA synthesis. Now, hydroxyurea doesn't directly impact folate at all, but if you had a concomitant folic acid deficiency, then you're going to get super macrocytosis essentially. So that's why we give folic acid prophylactically. Patients are taking hydroxyurea. So we're going to go ahead and assume that this guy is folic acid deficient because he only takes it occasionally. And with that deficiency and hydroxyurea, he probably has some kind of macrocytosis. So that's what we should start with. It's the MCV. MCV is going to be greater than 100 then, since typically a reference range would be between 80 to 100. So anything that is not over 100 is getting crossed off. Next up, it's really just go in the order of what you know. So MCV was the most intuitive for me, so that's what I started with. If you have homocysteine and MMA memorized, then you can jump to one of those. Otherwise, you're kind of playing the guessing game here. Maybe we'll try thinking about white blood cells first. So we said hydroxyurea and folic acid deficiency could result in DNA synthesis impairment. And so if that was the case, we wouldn't be able to make as many white blood cells. So we should probably see a low value. So probably either this option or this one. So D's already crossed off. Let's cross off A as well. Now we're down to 2. What about the reticulocyte count? Well, when red blood cells are developing, instead of dividing normally with DNA synthesis happening concomitantly, DNA synthesis is really not happening as well as it should be, but the rest of the cell is developing normally. So it gets bigger and it's ready to divide, but it can't because the DNA isn't ready. So you just get these big cells. Reticulocyte count would actually decrease in this case because we don't have DNA synthesis happening as well as it should be. So right away, we know that that eliminates choice C for us, and we're in with choice E. So whenever you're thinking about what's happening with the reticulocyte count, if something is impairing the ability to make red blood cells, it's going to be low. In this case, if we don't have folate, we can't make DNA, or if we're taking hydroxyurea, we can't make DNA. Same thing with B12, can't make DNA. What about an iron deficiency? Well, you need iron to make hemoglobin, so reticulocyte count is most likely going to be low there too. Reticulocyte count would be high in cases where there's no problem building the red blood cells. We just lost a bunch of them for some reason, like blood loss, hemolytic anemia. For example, it could be elevated in hemolysis or acute blood loss. Let's talk about homocysteine and methylmalonic acid though before we end the video. This is kind of memorization. I mean, it's just biochem. Biochem tends to be memorization heavy. I've got a fun way to remember it though. We've got our folate. All right, so folate and B12. This is how I remember it. Folate is B9. B9 like homocysteine. That's how I think of it. B9, homocysteine. B12 has a number 2 in it. So that's 1, 2, homocysteine and MMA. I know, super dumb. It works for me.